welcome to the London Ambulance Service Annual General Meeting, or for the more modern ones amongst us, Annual Public Meeting. It is a statutory duty for us to report and to share our annual accounts and report on the previous year, and that's what we're here to do this evening, but also to take the opportunity to share with you some of the work that we have carried out. Last year, we talked very much about the pandemic and our response. It has been increasingly evident that the only way for the ambulance service to respond to that pandemic is to do so with partners. And so you'll be seeing a few vignettes this evening of some of the pilots that we've been working on with our partners in healthcare in London to improve care for patients. And many of those initiatives will be taken forward for the future. We're also delighted that we've got our colleagues from London Air Ambulance here who will be doing a presentation later this evening. Present tonight are board members and members of our staff and partners. Other members of our board are with us but online. We do have apologies this evening from Anne Rainsbury, a non-exec director, who is on holiday, and I think we have to allow that. And before I forget to do this, I also want to pay tribute to Fergus Cass and Jane Mee, who were non-exec directors with us through a very difficult period, but both of whom have come to the end of their terms, but played a significant part in helping us move forward. So we will look at the highlights, but before we do that, I'd like to take just a moment to reflect on the members of our staff who we sadly lost through the period. Thank you. Can I remind people that you have the opportunity to send in questions as we go using slido.com with the hashtag LASAPM. And if you do that, we will pick up the questions and do our very best to answer them. So without further ado, and I should say our annual report and accounts are available online for anybody who wants to look at them. We now need to look at the minutes of our previous meeting held on the 29th September 2020. And for colleagues who were present, can I please ask, do you feel that they are an accurate record of the meeting? Yeah, I'm seeing some nods around the room. Nobody wants to differ, so we can accept those as a correct version of events. Thank you. So next, I'd like very much to introduce our new Chief Exec, Daniel Elkeles, who's been with us about 6 weeks now. We're delighted to have Daniel, an experienced Chief Exec from the London acute sector, previously at Epsom St Helier, who's got experience of healthcare generally, lots of healthcare experience over probably 20 years. Daniel, am I aging you? About 20 years in commissioning and in provision. He managed to gain capital to develop Epsom and St Helier, something for those of us who've been around and live in more or less that neck of the woods, knows been going on for 30 years. To actually have achieved the funding for a new hospital is great. And to work on building a team and the culture of the organisation, things that we need to do here. So without further ado, I'd like to introduce and welcome Daniel to the stage. Daniel.
Thank you very much, Heather, and thank you to the Trust Board and all the staff and volunteers in the London Ambulance Service for welcoming me as the Chief Exec this month. It's a huge privilege and honour to be here today. Actually, I've worked for the NHS for over 25 years, so I clearly look more youthful than I am. And I've worked in community and hospital settings, and I've been a commissioner. But it's not till you're actually here in the London Ambulance Service do you really realise the scale and reach of the organisation and just what it really does. It's phenomenal. It's also really evident just how hard the last 20 months have been for the teams in the LAS. And I can empathise from that with my experiences in community and hospital settings. But everyone is really exhausted, and we really need to put a huge amount of energy now into motivating people and enabling them to do really well this winter. In the past month, I have visited ambulance stations. I've been to the 999 and the 111 control rooms. I've been to our education centres and visited lots of our support services. I've also been out on the cruise 3 times, and I've met hundreds of our wonderful team members along the way. However, I know this is only a small fraction of the 9,000 incredible staff and volunteers we have, and I've got many, many more sites to see, so South East London tomorrow and on Monday. I want to thank everyone for being so welcoming and so candidly sharing with me their experiences. I've heard firsthand so many of the personal challenges they've endured during COVID, and I can't thank them enough for the hard work and sacrifice in caring for Londoners when they needed it most. I'm truly overwhelmed with admiration for everyone. It's clear to see that ensuring patients receive the right care in the right place the first time is really at the forefront of everything we do. I've also been able to see firsthand how leading edge so many of what our teams do is. We have won several awards in the last month since I've been here, where outstanding clinicians have delivered outstanding new services. It's important to stress that whilst for many life is steadily returning to normal, we have a new normal, which is the biggest demand we have ever experienced. And so now what we are doing is planning for a very challenging autumn and winter. Our priority as a trust is to make sure we support our staff to deliver as much care as possible so that we are here for Londoners when they need us most this winter. In the long term, I'm really looking forward to seeing how the LAS, through our unique position as the only pan-London provider of care, can really become London's integrator of access to urgent care and emergency care and help ensure Londoners always receive a world-class service whenever they need us. So now we're going to hand over to a short film from our fabulous Chief Medical Officer, Fenella, who's going to show us how we have worked with London's 5 integrated care systems to provide COVID care in the community close to home. Thank you.
As the only London-wide healthcare provider, it is extremely important that we work with the whole health and care system to improve patient care and outcomes. COVID at Home is one example of this. COVID at Home is a programme that has been developed across London as a way of providing comprehensive care in the community for patients with COVID-19. This is for COVID-19 patients who do not need to be in hospital for care, but required additional assessment and monitoring, either at home or on the road, until they reach full recovery. The programme was coordinated across London, but each integrated care system locally developed their services based on the needs of their population. The services included COVID assessment and management services, home oxygen level monitoring, and access to remote respiratory consultant support. Guidelines and resources were also developed for clinicians to support safe care and management of patients whilst they were at home. We worked with the NHS London regional team to ensure that anyone under the COVID at Home programme could be flagged on our system immediately and to get the right support and advice right away. This meant that more COVID-19 patients could be monitored and assessed closer to home, improving their experiences and freeing up more beds in hospitals for those who needed it. It meant we could transfer the call to one of our clinicians in our control room who could provide the right advice over the phone and send our crews where needed. To make sure patients who needed further care could get the right care at the right place first time, we worked with our NHS partners to agree referral pathways into COVID monitoring services across London. Working with North West London ICS, we also co-developed a process for our 111 clinicians and frontline crews to access advice from respiratory consultants, as well as contributing to the development of the guidance for clinicians when doing so.
And the reason it was so good at keeping people safe was because people really collaborated through all the stops at making sure that it stuck together properly, and that people who were safe to stay at home were able to stay at home. They had the information to understand when they needed to escalate. We had GPs on hand to make sure that they could support those people who were less ill, and LAS on hand who knew exactly when to respond to those people who were more acutely sick. And when they took people to the accident and emergency departments, the accident and emergency doctors knew exactly what they were dealing with when those people arrived. And then if people didn't need to stay in hospital, they very quickly could be transferred out again using the same methodology to monitor themselves safely at home and know when to escalate again. So it really helped.
It is through working together that we were able to set up these services in a way that patients whose conditions deteriorated or had concerns could access teams with the right advice and support both day and night.
So we have 5 integrated care systems in London with a population in each of about 2 million, which is why it's so important we work across the whole of the capital with London to deliver that care. I think these initiatives are really exciting and the way forward and safe for patients. So thank you, Fenella and teams, for that. We now need to, though, look at our performance over the year, and I'm going to ask Kadir Mir to talk to us about performance.
Thank you, Chair. Thank you, colleagues and members of the public. So it's my pleasure to be here today to be presenting an overview of the Trust's operational delivery during 2021. And as this will be my last APM as Chief Operating Officer and Deputy Chief Executive, I'd like to take the opportunity just to recognise the extraordinary efforts of all our staff and volunteers during what was an extremely challenging year. Just move on to the next slide. I'm going to give you an update, just an overview of what we do and what we did, our performance, some of the key challenges, specifically during Wave 1 and Wave 2, both of which happened during the financial year of 2021, the challenges that we faced and how we rose to it, and hopefully capture some of the achievements during it. Okay, next slide. Thank you. So just a few stats to hold in your minds. Because even as Chief Operating Officer, as Deputy Chief Exec, even I'm staggered on a daily basis of what we do and how we achieve it. So during 2021, we took 1.4 million 111 calls. That's one call every 30 seconds. Just hold in your head, we answer one 111 call every 30 seconds, 24 hours a day, 365 days a year. We took 1.8 million 999 calls. That's 3 calls every minute. So every 20 seconds, we are answering the phone to somebody in need. And we saw 1.1 million patients. So every 2 minutes, the London Ambulance Service is with a patient across 2021. And that blows me away. So what we do and what we achieve on a daily basis is just incredible. That 1.4 million calls in 2021 was up by 200,000 on the year previous. The 1.8 million calls was slightly down by a similar number, and the 1.1 million face-to-face incidents was relatively flat. And how do we do this? We do this with circa 500 staff in our control rooms in 111, circa 800 staff in our control rooms in 999, and circa 4,000 staff in ambulance operations. That's clinicians and managers. But we also do it with the support of a huge amount of support staff who are not patient-facing, but are essential nonetheless. And we have staff in our Strategic Assets and Property Directorates and in our IMNT, as well as our corporate staff, which account for over 1,000 more staff, just providing that operational response and supporting that effort. If those figures weren't staggering enough, in 2021, we delivered those services while improving our response times. So Category 1 response times for our life-threatening response, we improved our response times on average from 6 minutes and 51 seconds in 1920 to under 6 minutes. And for our Category 2 response times, we improved our response from just under 24 minutes to under 20 minutes. And if our response alongside our response times improving, we also delivered improvements in increasing and improving the clinical care we were able to provide to patients both over the phone by improving and increasing the number of patients we were able to hear and treat, as well as the number of patients we were able to see and treat in patients' homes in order to support and reduce the volume of conveyances to hospital. So our our hear and treat figures went up, our see and treat figures went up, our see and convey figures went down, and our ED conveyances also went down. So providing more clinical care in the face of a pandemic where patients best need it. If I could just move on. But the two biggest challenges that we faced during 2021 were the two significant COVID waves. The first in the beginning of the year, where during our busiest periods, our 111 patient demand went up fivefold, and our 999 patient demand doubled. And what we saw during 2021 were the busiest days in the Trust's history. If I could just share with you a few specifics on Wave 1. In Wave 1, just moving on a slide. In Wave 1, through March and April, the acuity of patients that were related to COVID significantly started to deteriorate. And so we had to increase significantly our call answering capability, the integration between 999 and 111, streamlining our operating model, introducing virtual GP consultations with our wider partners, transforming clinical pathways led by our CMO, establishing new control rooms capacity in order to answer the phones, and fast-tracking clinical training in order to increase the number of staff we had. And in Wave 2, just move on a slide, in Wave 2, although we'd spent the summer preparing our plans, anticipating a further wave, the impact was none less severe. And during this period of Wave 2, we received 77,000 COVID-related calls, and we saw 54,000 COVID-related face-to-face incidents. I fundamentally believe no other health or care provider in the UK has responded to as many COVID potential or COVID actual patients. And so the size and the scale of the response, I think, is unparalleled. But during the pandemic and during the busiest times in our history, we didn't stop there. So there was also a huge amount of transformation that we delivered. In June, we opened our Tactical Operations Centre. So for the first time in London's history, we have a dedicated centre that has visibility of primary, urgent and emergency care across London, across 111 and across 999. It allows us the ability as the London Ambulance Service to provide that system response and to support both our commissioners, our regulators, but also our colleagues in provider services to be able to manage and tailor our responses depending on where we see patient demand and need and where it's best directed. We also mobilise our integrated urgent care services in North West London. So we now work with partners in North West London ICS to provide 111/integrated urgent care in North West London. We also, for the first time in the London Ambulance Services history, and I think in any ambulance service across the UK, established partnership arrangements with 111 providers, not just in London, but in other parts of the country, in order to provide operational resilience in 111, both to us, but also to colleagues in other parts of the country. So we now have innovative partnerships with Derbyshire Health United and Hertfordshire Urgent Care where we can manage patient call demand and patient need dynamically, depending on where those pressures exist. A plug for colleagues in IM&T, because we also delivered NHS Net, moving 9,000 email accounts from our internal service onto the nationally recognised email system within the NHS. It's much more secure. No mean task during a pandemic, and some very grumpy colleagues. But it was a fantastic achievement, so a huge thanks to IM&T colleagues. We also transformed how we manage medicines. It's been a challenge for the London Ambulance Service for a number of years in terms of management and movement of controlled drugs across 67 operational sites, 80 sites in total. And we've established a new medicines packaging unit that's state-of-the-art. We only yesterday moved into a new logistics support unit, a dedicated, fit-for-purpose, modern logistics support unit to enable us to be able to manage the operations in terms of equipment and supplies across London, and something that's future-proofed and potentially an opportunity to work with other ambulance services going forward. We mobilised a pilot for paramedics in PCNs in Merton and Richmond. And we moved, for the first time in the Trust's history, off paper in terms of how we record patient, our triaging of patients. So we moved from 3 million pieces of paper onto electronic patient care record that is able to be connected to the NHS spine, provide better patient care in an integrated and interoperable way with the rest of the health service. And we opened 2 new dedicated training facilities, one of which we're currently in today. I think the achievements of the service during the pandemic are phenomenal, and I just, as part of my swan song, just like to pay tribute and credit to all of our staff, all of our volunteers across the service. Because not only have we risen to the challenge of the global pandemic, we've also transformed the organisation in the process in a way that I hope will have a sustainable and a significant future. So thank you very much. Ooh, I am supposed to now, sorry Philippa, can I now introduce a video from Pauline Cramner, QAM, on the partnership with UCLH on a innovative stroke pathway in north central London.
During the COVID-19 pandemic, having the option for healthcare specialists to remotely access patients has been invaluable. Since May 2020, we've partnered with University College London hospitals to use video conferencing to bring stroke specialists into the patient's home.
Hello Rebecca, my name is Rob Sinister. I'm a stroke neurology consultant. I'm here to work with James first to decide the right pathway for you.
They are therefore able to jointly assess patients with the input of the stroke consultants via a video call. Our medics and the stroke consultant then come to a joint informed decision on the best onward treatment for that patient. This could be taking the patient to a specialist stroke unit or an emergency department, depending on their needs. In this partnership, a patient suffering from a trans-ischemic attack, a mini stroke that has seemingly resolved itself, can be referred directly into a stroke clinic appointment. Normally, we would take such patients into the emergency department, where they will likely face an extended waiting time and then require subsequent appointments. Video conferencing allows them to be seen directly by stroke specialists much more quickly and provides additional reassurance.
I had absolutely amazing team, an amazing service. I couldn't thank him for so much, especially meeting the doctor on the iPad, because it made me feel at ease. But at the time was of the essence on me. recovering so quickly and with the amazing team that I had.
The central reason, I think, for the success of this project was because of the close relationship right at the beginning between the UCLH clinicians and the London Ambulance Service team. We've been able to create the very simple structure of a direct contact informed by video information between patient and ambulance crew at scene and either one or more specialists remotely, all able to discuss right at the beginning of the ambulance journey where the patient is best and quickest managed. But there's no question that the best way of recovering from a stroke is for the symptoms to be reversed right at the front door.
This partnership is a joint working between clinicians, combining the expert skills of the stroke consultant with the LAS expertise in out-of-hospital care. True collaboration for the benefit of the patient.
So you will see that peppered throughout this evening, we're giving you little vignettes of our collaborative working, which improves care for patients, taking us away from those people who think we're a transport service. We are not. And also, as evidenced by Kuday in his presentation, we currently only take about 50% of those patients we see to hospital. What you're seeing in that sort of example is how we can take people to the right place at the right time so that they get the best clinical outcome for them. And it's true collaboration. But now we move on to accountability statements that we have to have. And I'm asking both Lorraine Buse, our Finance Director, and John Martin, our Chief Paramedic and Quality Director, to come up to talk about the finances of the last year and then the quality account. So Lorraine and John.
(2021) was clearly another exceptional year with the continued suspension of formal contracting and financial plan targets. Operational pressures never returned to normal, and we experienced a second significant COVID-19 surge from the end of November through to early February. During 2021, LAS significantly increased its income over the previous year with the continued block and top-up arrangements for COVID, and we received additional funding from North East London and South East London 111 integrated urgent care services to meet the increased demand from Think 111 First national initiative. We also took on lead provider responsibility from November for the North West London 111 call service and integrated urgent care services in partnership with LCW and PPG providers, and continued to invest in all available budget for capital for the benefit of our patients. And as we look ahead to 21-22, our capital programme requirements remain above historic funding levels, and we're expecting to complete a number of exciting infrastructure projects which will consolidate the transformation that's been engendered by COVID-19. So that's an overview. I'd like to turn now to my formal duty for this evening, to present a highlight of the accounts for the year ended 31st of March 2021. I'm pleased to report that the London Ambulance Service met all of our statutory financial duties for 2021, which are summarised on this slide. We came in below our external financing limit, which is the way the Department of Health controls cash, and we generated 2.2 million more cash, largely due to timing differences on planned payments. We fully used our capital investment budget, spending 99.3% of our capital resourcing limit. And it was pleasing that we delivered a 2.6 million operating surplus for the year, which was larger than planned, therefore meeting our break-even duty. Finally, we saw a continued improvement in settling non-NHS invoices by volume and value, as measured by the Better Payment Practice Code of 30-day settlement of our suppliers, and are continuing to improve the speed at which we pay such invoices. So I'd just like to do some highlights on our income and our capital. Our total income was 570 million, and that's up 30% from 1920, 438 million. Our 999 income made up the vast bulk of this at 394 million, excluding COVID-19 and top-up income. COVID-19 top-up, reimbursement and national additional funding was 117 million, and that compared with 7 million in 1920, largely to cover the costs of COVID-19 related activity. And as I've mentioned earlier, our 111 and IUC service income grew from 19 million in 1920 to 29 million, reflecting move to block arrangements and increased call demand in South East London and North East London, and the award of the new service in year for North West London. Turning to capital, our capital investment was a record 43.8 million in 2021, up from 22 million in 1920. That's double the previous year. And we've made some significant investments, some of which are pictorially shown here. But just to identify a few, our digital 999 programme and electronic patient care record has moved us to electronic patient records, which will enable greater integration of health records and London Ambulance Service crews being able to send information ahead to receiving hospitals or to better share information with care homes and local GPs when they treat patients on site. Investment was also for COVID-19 resilience, which was really critical to ensure the safety of our crews. We invested in our expansion of control rooms and modernisation of those to meet call demand increases. And finally, we made a significant investment in supporting additional double-crewed ambulances. Our planned investment for 2021-22 builds upon and continues these investments, especially in consolidating our training estate and office requirements, improving our control rooms and oversight of logistics and medicines management, and supporting greater integration of health and social care, all with the aim of improving our patient care outcomes and the safety and well-being of our staff. Lastly, our external auditors have concluded that the accounts present a true and fair view and have issued the Trust with an unqualified audit opinion, confirmed that the Trust met the unqualified value for money conclusion and found that it had proper arrangements in place to secure economy, efficiency and effectiveness, which are our duties. Accounting for the costs of COVID and suspension of the normal contracting and financial arrangements has posed a number of problems for all the NHS, with uncertainties over property valuations, stock counting, which can lead to auditors modifying or even qualifying their opinion on the accounts. I'm pleased to confirm that our auditors have not modified their opinion of our accounts, and I would like to take this opportunity to commend my finance team for this achievement, especially as they've had to do this while working remotely to enable corporate space to be utilised for the clinical response to COVID. The full set of our annual report and accounts can be found on our website under publications, and I'm pleased to commend these accounts to you this meeting.
Well, good evening. It's great to be with you at our annual public meeting, my first as Chief Paramedic and Quality Officer. And I'm pleased to be able to present to you our quality accounts this evening for the year ended 2021. Much like Lorraine, the quality account sets out a budget. At the beginning of the year, we set some priorities as a board. We then monitor them across the year. And then at the end of the quality account, we set the priorities for the coming year. And next year, if at the annual public meeting, I will be presenting on how we've achieved against them. So last year, we set out 18 quality account priorities as a board, and I'm going to take us through now the achievements that, in spite of COVID, we've managed to do against these quality account priorities. So looking back, you'll find the quality account on our website. It's 42 pages long, but it's a good read and a chance for you to really understand how these go. And if you turn to page 14, you'll find the review of 2020-21. So the first priority we set was to implement the Patient Safety Incident Response Framework, also known as PSIRF. We're the first ambulance service in the country to do this, and I'm pleased to say that we have implemented that. Is now live across our organisation. This allows us to review incidents in a different way, focused on making sure we pull out the learning from our clinicians when things don't go quite as planned. Our second priority was to introduce thrombolysis for our advanced paramedics in critical care. We'll be watching a video on this shortly, but 32 of our advanced paramedics have now been trained and are providing this extra care to patients across London. Thirdly, we set out to train some of our advanced paramedics in non-medical prescribing. We set out to do 10, and by the end of the year, 10 had either started or completed their training and are now prescribing medication within urgent care. Fourthly, we set out to look at our security, especially around vehicles and equipment. And during the year, we undertook some mystery shopping audits to see how our security has improved. And I'm pleased to say that the number of incidents related to security measures has come back to our average across the year. Our fifth priority was linked to our storage of medicines, and across the year we introduced 15 new controlled drugs rooms, and we also saw a reduction in our controlled drugs incidents. So this is where counting doesn't quite add up. We managed to improve that across the year. Our sixth priority was to introduce an escalation plan within our integrated urgent care service, so that's the 111 part of the organisation. We established that escalation plan during the year. It's now in place, it's regularly being audited, and on the basis of that audit, we're tweaking and learning from that escalation plan to further improve as we move forward. Our seventh priority was around our staffing levels within the 111 service, and during the year we changed our rosters. We've been monitoring staffing carefully, especially against the increased volume of calls that Kadir outlined, and improving on our integration across the services. The eighth priority is the one that you'll read in the quality account as the one which we didn't quite achieve. Except we did achieve it, and we have achieved it now. So our eighth priority was to roll out a Tempus monitor. This is a little ECG device that doesn't weigh very much on our cycle response unit and our motor cycle response unit. The reason we didn't do it is because those two services were suspended during COVID. The cycle response unit is now operational again, and the Tempus unit has been rolled out across that service, providing a much needed lighter unit on the back of the bikes. Our ninth priority was to invest in the health and well-being of our staff, and we did that in both physical and mental health across the year. You'll find within the document numerous different initiatives that we tried and continue to roll out. A new app, the 87% app that our staff can access on their mobile phones, immunising our staff, creating healthy spaces within our workplaces, and we're pleased to report that we saw a decrease in our moving and handling sickness during the year, and also an improvement in our staff survey results related to wellbeing. And all of that against the backdrop of COVID, which has been a really difficult year for all of us working across the London Ambulance Service. Our 11th priority was to reduce violence and aggression against our staff. Really important for us that we continue to focus on this priority. We've introduced violence reduction officers, and we're also trialling body-worn cameras across 4 of our sites now to see what impact that has on continually reducing the aggression that our staff continue to receive. Our 12th priority was to focus on delays. During COVID, we saw that there were peaks during the waves of lots of demand, and it was difficult to get to some of our patients. We introduced a way of reviewing those, so we were looking at a number of patients to see what changes we could make. And although I wasn't in post, if you read in the report, you'll see huge changes that were made between the first wave of COVID and the second wave, and learning as an organisation from that. The 13th priority was around integrating our 999 and 111 clinical advice services, and the team managed to do that across the year, and we now have a more integrated service. There's more to go, and that will feature in our priorities for this coming year. Our 14th priority was around electronic patient care record, and as Kadir reported, we successfully rolled that out in the midst of a pandemic, which now means that over 90% of the patients we interact with are having a digital record stored, and we have hundreds of thousands of those records, both for real-time patient care but also for future research. Our 15th priority was establishing a quality improvement hub, and in November last year we tried that in one of our areas, and we will now be taking that learning forward for how we structure the organisation around quality improvement. Nearly there. 16th priority was to reduce bullying and harassment, and across the year we introduced lots of communication to really focus on this. It was significantly larger than pre-COVID era that we had more communication, and live TV is one of those things that we did on a regular basis. The staff survey results for last year show improvement against 30 of the 75 questions, no change against 41 and a deterioration in 4. And we see a improvement in those that are related to bullying. So this quality account priority, we believe, has been a success. The 17th priority set last year was to roll out some paramedics as a trial within primary care networks. So this is general practitioners. And in Merton and Redbridge, we've had paramedics working in those areas. And 18th, the last priority we set in 2021 was to focus on our well-being of our staff, specifically related to COVID-19. And in this section of the report, you'll find how we've worked with the London Fire Brigade, the Metropolitan Police, the AA and other partners to support our staff on the front line during the pandemic. Also, the establishment of the Wellbeing Hub and the rollout of the vaccination programme for COVID across our staff. So 18 priorities that we set last year, all of which we've made significant progress on this year. So now we turn to the next year, so 2021 to 2022. And as a board, we've set 10 priorities for this year. To do that, we looked at those priorities which we did last year, which ones we need to carry forward. We've looked at the emerging CQC, that's the Care Quality Commission strategy. We've looked at our learning from the COVID-19 pandemic. We've looked at intelligence sources that we have. And importantly, we've looked at what matters to our staff, our patients and our communities in setting these 10 priorities. So the 10 priorities for this coming year, 4 relate to the SAFE domain. The first is to carry on with our implementation of the Patient Safety Incident Response Framework. The second is to continue our review of staffing within the Integrated Patient Care Service, so 111, and specifically look at senior clinical support within that arena. The third is to focus on our medical equipment, including being able to track it, service it, and make sure every piece of equipment is available for our clinicians to use. Fourth is related to medicine storage, and we are shortly to be opening our new medicines packing unit. And those are what we've set out against the SAFE domain. Against the caring domain, we are going to continue with the implementation of our patient community and engagement strategy throughout the year, and we'll report back on that at the end of the year. Against the effective domain, we've refreshed our clinical strategy with Fenella as the Chief Medical Officer, and we will be implementing that further and reporting on that at the end of this year. So our 6th priority is to continue implementing our clinical strategy, a specific focus on innovation and our Right Care, Right Place programme. Against the responsive domain, we continue to integrate our 999 and 111 services carried forward from last year to ensure that every patient that contacts us via either telephone number gets a timely and rapid assessment. And we've set ourselves 3 priorities against the well-led domain. The first is to introduce the Station and Service Accreditation Programme. This is very much about local leadership for quality in their areas. We tried it last year, it was very successful, and as we move through this coming year, we will be rolling it out across the organisation. Our 9th priority we're setting for this coming year is to implement our cultural diversity and inclusion strategy, very much focusing on our 4 values as an organisation of being respectful, professional, innovative and collaborative. And lastly, under the well-led domain, and our 10th priority that we're setting for this year, is to continue our focus on health and well-being of our staff, especially looking at how work-life balance emerges from the end of this COVID pandemic. So a rapid take-through of our 18 priorities from last year set, and the 10 priorities we've committed to as a board for this year. So I will commend the quality account to you, and now hand over to our next video, which is the Frailty Unit partnership with Barking, Havering and Redbridge University Trust, and Kadir Mir is going to appear on the screen. Thank you very much.
As the only London-wide healthcare provider, we have a unique opportunity to bring together urgent and emergency care and provide the best possible care we can to our patients. Through working in close collaboration with London's 5 integrated care systems, we are driving significant improvements to the quality of care for our patients, reducing unnecessary trips to an emergency department and providing access to the right care at the right time in the most cost-effective way for the tax-paying public. Changing how we respond to various patient groups with different health and care needs is crucial to this. This would not be possible alone, so we work with our health partners to provide a more tailored response to patients who can have their needs met in a more appropriate way. One area in which we have done this is North East London, where we have been working closely with Barking, Havering and Redbridge University Hospital Trust to support the development of the Frailty units at King George Hospital and Queen's Hospital. It is well understood that emergency departments aren't always the best place for elderly and frail patients. Evidence shows that older, frail patients who are taken to an emergency department have a significantly higher chance of being admitted and having longer stays in hospital. This has adverse effects on their physical mobility and health, and can affect their provision of social care and cause considerable distress to patients and their families. In working with our partners to support the development of frailty units, and in embedding this pathway as part of our service in both our 111 and 999 services, we can ensure elderly patients with frailty who are in need of secondary care can be taken to a specialist unit which will provide care from an experienced geriatric team in a calming and comfortable environment. As this unit is separate to the ED, our crews can take elderly patients with frailty there directly. The patient is seen more quickly by a dedicated team of specialists, and the handover time for LAS crews is far shorter.
So I visited the Frailty unit at Queen's, and I would certainly be happy to have an elderly relative there. And I did say at the time, I'm not quite in that age catchment, but I would have been happy to be cared for there. But because of the leadership in that team, the manager being an occupational therapist, the nurse lead and the doctor, providing the right environment to get a quick assessment and to be able to get people home without putting them through a big tower block and spending lots of days there on, frankly, and it's not a criticism of the hospitals, but not friendly looking wards for people who might be a bit confused. So I don't think I'm confused yet, but I would have been happy to be in that unit that I saw. Fenella was with me at the time and heard me say that. And I can't believe there can't be people without questions, so just let me remind you, it's hashtag LASAPM on Slido. Please do put in your questions. It's now my pleasure to ask Kadir, Jonathan Jenkins and John to present the work of the London Ambulance Service with the Air Ambulance.
Thank you, Heather. I think we will open with a video first, and then hopefully we'll be able to explain and share a bit more details.
My name's Jason Morris. I'm by day a clinical team leader for the London Ambulance Service. I've been a flight paramedic with London's Air Ambulance for the last 6 years. It's a brilliant job, and it's amazing. Even after 6 years, you hear the klaxon, your heart will speed up, the adrenaline will still run no matter how long you do it. 1 minute you're sitting there doing nothing, the next minute you're going to the sickest person in London. So within a flight paramedic's role, we have 2 jobs. We do 50% in EOC, so emergency control room, and we do 50% flying. So I spent 12 hours yesterday sieving through the 5,000 calls, looking for the types of calls, and we average 5 activations a day now with London's Air Ambulance. So we did 4 during the day and 2 at night. So in control, it's just lots of ringing back people, trying to establish and working out, we have 1 asset for London. We need to make sure we send it to the right person. And then control, we're the pivotal. Without that person in control, with a paramedic in the control room, the service wouldn't exist. When we're here on the helipad, it's a very challenge and check day. So we start the day normally at 6:30 in the morning, and we have certain checks for the day that we challenge and check every bag, take it apart, make sure it's all checked. We'll have a briefing at 9 o'clock. And then we go through training throughout the day, so we'll try and do a scenario around about 10 o'clock. And then depending on what the day brings us, it depends on what happens. So we're constantly on the hook, so we're not allowed to leave here, so you have to plan your day. You know, you have to have your lunch, so we don't leave any further than 17th floor, so we're stuck here all day. On the road, you're normally by yourself, you're with your crewmate, but here you're working with a doctor, you're going to see the most sickest patients. So whereas on the road I'd see 1 or 2 sick patients a year related to trauma, here so far I've seen over 200, 300 patients who are severely sick. So your level of acuity has gone up, so your level of skill needs to go up to match that. But we are part of a team. The doctors couldn't work without us, and we can't work without the doctors. So, and likewise with the pilots. For 6 years, you know, you form this amazing bond. You know, you get to meet people which you never have the opportunity to do, and work in a world-leading service. And that's what London is. You know, we're pioneering Roboa, which, if you had asked me 6 years ago, would I be putting a balloon up someone's artery in the middle of a road? No. You know, yes, we've always done thoracotomies and open heart surgery, but we're now pushing the boundaries, and that's the type of service you're leading. And with that, you need to do lots of training and work as a team.
So colleagues, I'm going to ask Jonathan Jenkins, the Chief Exec, who it's a pleasure to introduce, just to share some details on the history of the London Air Ambulance and the partnership. I'll say a couple of words and then we'll hand over to the clinical leaders who really make it happen.
Kadir, thank you very much indeed. Heather, Daniel, thank you ever so much for the invite to join you at this meeting. It is an absolute privilege to be standing here at the meeting today. And I think I should start by paying tribute to our friends and colleagues, past and present, staff and volunteers at the London Ambulance Service with whom we've taken every step of the way over the past 32 years. So it's incredibly, it's a great opportunity to stand in front of you today. So thank you. London's Air Ambulance Charity is a charity. It's a registered charity. We are primarily funded by the generosity of the people that we serve. And we come together in partnership with the London Ambulance Service, with Barts Health, to provide 2 key services: the Helicopter Emergency Medical Service, HEMS, as you saw in the video, which has been attending those most critically injured people in London for 32 years. We also provide the Physician Response Unit, the PRU, which is now 20 years old, which has been taking great steps in the community emergency medicine, and Tom and Tony will take you through the details on that shortly. The important thing that I really wanted to stress is that these fantastic services and the delivery of what I would like to believe is a world-class service to the patients when they need it the most is only possible through the tripartite partnership that comes together to create London's Air Ambulance. That's us, the charity, London Ambulance Service, and Barts Health. And that tripartite will only work whilst we have some core key values: the mutual trust between the partners, the ability to have constructive, candid conversations when we need to, and also the key wish of all of us to maintain a forward progression, a momentum in the care that we give to the patients that we serve, so that the patient tomorrow will hopefully get a better experience, better outcomes than the patient today. And that drive for continual performance for patient benefit is what typifies the values of that tripartite and has done over the 32 years. Thank you.
Thank you, Jonathan. And just to add, I think what Jonathan and I have been keen to establish over the last 2 years is that trust and confidence in the relationship, recognising that we don't always agree, but when we don't, being able to have honest, candid conversations, but an absolute commitment to continue to support and develop the partnership to deliver what is truly world-class care, and care right at the edge of kind of clinical practice, recognised internationally, isn't it? So our clinical leaders hopefully can share a bit more of that as we hand over to them. Over to you.
Ladies and gentlemen, thank you very much for the opportunity to tell you more about our service. My name's Tom Hurst. I'm the Medical Director for London's Air Ambulance. I'm going to touch very briefly on the history of the organisation, which, going back to our first flight operations in 1989, has always involved the three partners in delivering this service. In progressing the service over those years, we've had a huge number of clinical firsts, and we retain a worldwide reputation for clinical excellence and for innovation. What we've also done in partnership with those other organisations is to increase the delivery of service to patients, starting off with an aviation-only service back in 1889, where we are now with 2 aircraft, with 24/7 cover using a mixture of aircraft and cars, and hopefully from late this year with an additional duty team at peak hours. The service continues to evolve both clinically and operationally. Next slide, please. On any given day on the aircraft, a significant team of people come together, both on the deck itself, on the aircraft, and in the control room. And those people come together from the three organisations that make up the tripartite. And as Jason Morris said, none of us could do our jobs without any one of those individuals. The aircraft can't safely leave the deck without our fire crew, and so on and so forth throughout that mission. That day-to-day collaboration is at the core of what we do. What I'd now like to do is to describe a couple of developments over the course of this year which highlight the drive forward in furthering what we can do for the patients in London. Next slide, please. I don't think it's controversial to say that major incidents, of which we've sadly had a few in the capital in the last 5 years, require extraordinary resources and extraordinary leadership. The medical support to that leadership, to that chain of command, is essential for delivering the very best possible patient outcomes for those people, those individuals unfortunate enough to be caught up in some of these dreadful and difficult events. Over the 32 years that London's Air Ambulance has been in existence, doctors on that service, employed by Barts Health, have attended almost all of the major incidents in London and have developed a very extensive and deep knowledge of the medical care of patients at these scenes. What we've been able to do this year is to further develop that partnership and to develop the working relationship between our doctors and the London Ambulance Service and improve the integration of the medical advice to the chain of command. London Ambulance Service have developed a really highly developed system of medical advice from scene all the way up through to strategic level. And London's Air Ambulance is proud to provide a part of that and to be able to support world-class advice and support to medical commanders, to incident commanders during future major incidents. This delivers a cadre of senior and experienced doctors who are used to working in this environment and, importantly, used to working alongside London Ambulance staff. This system, I think, is resilient, I think it's high quality, and I think it demonstrates some really, really valuable system efficiencies for both partners. Next slide, please. So London's Air Ambulance, what is it that we do at the core of the sort of clinical mission? Well, it's about delivering life-saving treatments, really complex life-saving treatments, to some of the most critically injured patients in London. And it supports the excellent care that these patients are already getting from London Ambulance Service clinicians and staff who are almost always on scene as the first clinical asset. Our data, however, shows two problems. It shows that there are around 200 patients a year that we're not able to reach because we don't have an additional, we don't have a team. We only have one team on duty at any one time. And therefore, inevitably, there will be occasions where we're not able to support our LAS colleagues in dealing with these critically injured patients. We're not able to offer the patient the best possible chance of a good outcome. The second problem that our data shows is that we're slower to reach some patients after dark. When the aircraft goes home and we have to contend with London traffic, trying to deploy one asset across the whole of London means we're inevitably slower to the more distant areas of the capital. So the solution to this problem is for us to be able to provide an additional team during those busiest hours. Next slide, please. So we're going to implement an additional team covering the busiest duty hours from 2 o'clock in the afternoon until midnight. And this will enable us, firstly, to reach those patients that we're not able to reach because we have no extra team to send, but by being able to deploy a road-based asset to the east and the west of the city, we'll hopefully be able to make some inroads into those response times. So there I've given you 2 examples of current collaborations between Barts Health, between the London Ambulance Service and between London's Air Ambulance Charity that I think really exemplify what we are about and what we hope to achieve, and indeed achieve more of in the coming years. I've focused these examples on patients who have been critically injured, and I'd like to hand over to my colleague, Dr. Tony Joy, to talk about patients with a different set of issues.
Thank you very much. It's a real pleasure to have this opportunity just to say a few words as part of this presentation about the Physician Response Unit. My name is Tony Joy. I'm a consultant in emergency medicine and pre-hospital care, employed by Barts Health, working very closely over the last few years of my consultant career on collaborative projects with London's Air Ambulance Charity, London Ambulance Service, and with Barts Health. So I'm just going to firstly describe a little bit of the history, and Jonathan alluded to the fact that the PRU is 20 years old this year. And I just want to describe a little bit about what this model of care is all about and talk a little bit more specifically about the last 12 to 18 months. So the PRU delivers community emergency medicine, and this is a pretty novel package of emergency care, which I'm really pleased to say is gaining a bit more traction, and actually there are other PRU-type services now setting up around the country following the lead of this collaboration between LAS, LAA and Barts Health. When it was first set up in 2001, it was broadly in response to increasing challenges for the ambulance service to meet ORCON targets, which they were then, and recognising there was going to be the introduction of a 4-hour standard for emergency departments to see patients in a timely way. And I guess those 2 metrics are perhaps as resonant now, whilst we're still under huge challenges across urgent and emergency care. And it was set up to provide a different type of response, less away from the critically injured patients, but to the broader, full breadth of emergency presentations, what we would sometimes describe medical emergencies, and essentially went through several iterations as a service. And since I was involved in about 2014, alongside colleagues, notably Bill Leaning, who's the senior paramedic working for the service, we've taken it on a few developmental steps. We recognised that what we wanted to do was offer the most support that we could to LAS to provide care in situ for patients that meant that patients got the most appropriate care in the right place first time. In 2016, we introduced more novel diagnostics. We introduced point-of-care blood tests. We also took the service to 12 hours a day, 7 days a week, with a cadre of clinicians that weren't simply the HEMS doctors that came on a secondment just to work for the air ambulance and were primarily focused on the delivery of critical trauma care, but were a team of clinicians that were focused on community emergency medicine and the wider breadth of emergency presentations. We set up the PRU Fellowship, and in 2019, based on impact that we were making in the local community centred around the Royal London Hospital, the Borough of Tower Hamlets, we extended that footprint to the boroughs of Newham and Waltham Forest as well. In 2020, we were able, based on the impact that we were demonstrating, to extend and roll out a second car, and by this point we had 10 doctors on fellowship, and that's the largest emergency medicine fellowship in the country, delivering this opportunity to work alongside colleagues from the ambulance service outside of the hospital setting. And that's been a huge step forward in giving more doctors the chance to collaborate with paramedics and EECs and technicians and other grades of pre-hospital provider. And that's really rubbed off on their in-hospital practice as well, helping to learn more about care outside the hospital, care in the community, and better partnership working. In 2020, we're also asked to further extend our footprint further east towards Barking and Redbridge. And I guess the 3 main impact areas that we try to focus on are taking enhanced care to patients through a senior decision maker facilitated by diagnostics and therapeutics not normally available in the ambulance service domain. and that means that we can give better patient outcomes for people in situ. That bit about collaboration and hybridisation of the workforce has been very powerful, and giving the EACs, the EECs that work alongside the doctor on the PRU, a chance to learn a new level of clinical assessment and learn more about how in-hospital care might work when taken out into the community. And through that, we deliver system efficiencies, which means that we lead to a reduction in ambulance conveyances, a reduction in attendances in the emergency department, and a reduction in patients that normally would be admitted to hospital, helping to save bed days as well. Can I have the next slide, please? So in the last 18 months or so, we've had to be really very agile, as has everyone working in urgent and emergency care, to try and offer the most targeted, the most appropriate response that we can. And so an example of that was early this year, with pretty much no notice, we were able to put a third car out in order just to support, in the height of the COVID wave in January, additional response, recognising that any support we could offer LAS was going to be hugely valuable. We've worked up some specific pathways, recognising that in the COVID era, there are very clinically vulnerable patients where there's a very new and novel risk of being seen multiple times by healthcare providers, and specifically in hospital, and trying to reduce the risk of exposure to infection. For instance, for patients on chemotherapy, we've got weakened immune systems and patients with complex frailty. So we've worked to support an acute oncology pathway, meaning that we can be sent to patients with the ability to provide definitive care for patients with oncological emergencies, and where it's needed for them to be admitted to hospital, we can target them directly into the cancer wards. We've also recognised that there's a number of patients with complex needs at the end of their lives. And specifically in COVID, there's been huge anxiety about going into hospital to die, perhaps more isolated because of the difficulty for patients' relatives and family members to visit them. So we've worked with LAS to offer enhanced care for patients that are dying, working with the local hospices, and taking a package of end-of-life care, which has been hugely rewarding. So it really has been a privilege working in this collaboration, and I look forward to the PRU going on to bigger and better times. Thank you.
I'm really excited to have joined an organisation that has such a strong collaborative and rich history with London Air Ambulance and Barts Health. And just in the last few moments of this presentation, we want to outline the career development opportunities for paramedics. Paramedics have been at the heart of HEMS from the beginning, and working alongside our medical colleagues have provided outstanding care over the last 32 years, as we've seen. London Air Ambulance has always been a dream for many paramedics, and a great place to practice, to understand how you get, as Jason outlined in the video, exposure to many critically ill patients. Under the tuition and expertise of our medical colleagues and doctors, our paramedics have been developing. But we now find ourselves in 2021 and an opportunity to continue developing paramedics within the London Air Ambulance Partnership. On the screen, you'll see the College of Paramedics Career Framework. This outlines clinical practice, leadership, research and education for paramedics in such the same way as medics already have. So this evening, we're pleased to announce that the London Air Ambulance are going to fund a paramedic to lead on the development of a career framework within HEMS for paramedics. And we look forward to this coming year and seeing how that career framework will develop. So we end our presentation there. I'll say a huge thank you again to London Air Ambulance and Barts Health for our collaboration with them. Now going to watch another video which is related to the second quality account priority. That's the clot-busting drug that our advanced paramedics give to patients who are in cardiac arrest having had a pulmonary embolism.
At the London Ambulance Service, we have true clinical experts in their field who are leading the way to develop change and strive for improved outcomes for our critically unwell patients in a pre-hospital setting.
Since 2014, we have had advanced paramedic practitioners in critical care, like myself, working within the service. APPs are senior clinicians who undergo extensive additional education and training. This group of staff have advanced clinical skills and are able to carry additional medicines to help give London's most seriously ill and injured patients the highest chance of survival, as well as improving the experience for our patients. This includes treating patients in cardiac arrest, where a patient's heart has stopped, something which affects around 10,000 people in London a year. On average, LAS APPs attend at least one cardiac arrest per shift. This means we have both the education and the exposure, which allows us to be true experts in managing patients in cardiac arrest. Cardiac arrest survival rates across London are similar to those reported nationally and internationally and have not changed significantly in the past 7 years. Currently, 1 in 10 patients survive a cardiac arrest and are discharged from hospital. One of the possible causes of a cardiac arrest is a significant pulmonary embolism known as PE. This is a blood clot within the blood vessels which supply the lungs. Through years of advanced practice in this area, APPs at LAS felt that there was more that could be done on scene with earlier intervention for patients suffering from a PE cardiac arrest.
Since 2016, the team have led the way to develop a new model of pre-hospital cardiac care for these patients, in the hope of increasing chances of survival in a PE cardiac arrest on scene. The team, with support from the Clinical Directorate and the Trust Pharmacist, have looked at how we can improve survival within this cohort of patients. This includes looking at the ability of the advanced paramedics, guided by operating procedures, to identify patients where the cause of the cardiac arrest is highly likely to be due to a PE. The team assessed hospital interventions to manage this group of patients in cardiac arrest, which includes the use of clot-busting medications. The team found that if these clot-busting medications were administered by an advanced paramedic on scene, this could potentially reduce the time to treatment by over 50 minutes. In patients where every second counts, this was seen as a potential benefit worth exploring. London Ambulance are currently trialling the use of ultraplays, which, when administered correctly by an expert clinician at the earliest opportunity, has the potential to save someone's life on scene. The LAS is the only paramedic service delivering ultraplace administration for potential PE cardiac arrests. This is one of a number of true interventions in pre-hospital cardiac arrest care that the London Ambulance Service has been able to implement through having the Advanced Paramedic Programme. One of the key tenets of the programme is ensuring that patient care and the chance of survival is optimised through these marginal gains. For investing in our clinical workforce, listening to their demonstrable expertise and supporting them in the development of an evidence base to implement the model of care and practice safely across the capital, our clinicians are able to make a real difference in pre-hospital care and the outcomes of some of London's most seriously ill patients.
Hashtag LASAPM for your questions, please, on slido.com. So that brings us to the part of the agenda where I give out some thanks. And I always worry about this because I don't want to miss anybody out. So firstly, I'd like to thank all of our staff. And today we had a staff member come and talk about being shortlisted for a national award. And when we said to him, what else could we do? And he said, it's about thank you. So the message to all of my colleagues around the board table, but every member of staff, is to remember to thank each other. And tonight, from me as chairman, Daniel as chief exec, and the board, we want to thank all of our staff, but also our volunteers. And our volunteers are quite amazing. Last year, they volunteered 33,000, nearly 34,000 hours and responded to 10,500 incidents across London. They are absolutely amazing and we are very grateful to them. We've been hearing a lot about partners this evening and other providers and those who've worked with us, all to help us improve care for Londoners. So we would like to thank all of those, whether they're in health, in the police, in the fire brigade, the AA, or wherever they are. And when we talk about this, we're talking about our staff, we're talking about absolutely everybody who works for LAS, who has a role in helping us provide excellent care to patients. So wherever you are in LAS as an employed person, please accept our thanks. Occasions like this don't come together without a lot of work from a lot of people. So Bobcat TV, thank you so much for getting this moving. I'm going to say it's gone very smoothly from my perspective. I hope you're not going to break it down now, but it has been a very smooth operation all day, actually, for our live stream board meeting as well, so thank you. The comms team, a phenomenal amount of work under Anthony's leadership, Philippa and others, putting the films together, prepping us and getting it all together, so thank you very much. LAS IT, again, really helpful. We wouldn't be able to do it without you. And the staff here at Newham Education Centre who helped facilitate the meeting when they're actually very new occupants of this part of the building. So thank you very much. I'm also going to thank my board colleagues, non-execs and execs. So for the non-execs who give up their time for really very little reward other than helping benefit patients, they give an inordinate amount of time to help us take the service forward. And also a big thank to the executive team, who I think you have seen tonight. They've demonstrated their leadership through what's been a terrible pandemic. So although we sometimes seem to, as a board, challenge, and that's part of our role, critique some of the work, I think tonight has evidenced the enormous benefits they have given to the population of London through their work. So a big thank you to the executive team. And now we need to move to our last video of this evening, which is a film about well-being, and Damien is introducing it.
The last 18 months really have been some of the most challenging times we've experienced as a service. Our staff and volunteers have been working harder than ever before with little respite. In the early days of the pandemic, it was clear to us very quickly that the welfare and well-being of our staff and volunteers had to be our top priority so we could look after our people. In the summer of 2020, we set up our first wellbeing hub, a single point of contact and access for our wellbeing and support and services for staff and volunteers available 7 days a week. The team has helped over 3,500 staff and volunteers with support on everything from mental health to bereavement support and much more. The Wellbeing Hub has also expertly coordinated practical ways of making our team shifts a little bit easier, such as by running our tea trucks.
Tea trucks are vehicles run by staff and volunteers who deliver refreshments to colleagues at hospitals and LAS sites and offer a supportive ear if colleagues need to chat on a quick break. They offer the chance to talk for when crews have been at stressful incidents and a supportive and understanding listening ear. This has been as important as ever in the past year.
At the peak of the pandemic especially, the service was receiving a huge amount of food and treats donated by the public and by organisations. The tea trucks meant we could distribute this to colleagues all across London. We were humbled and grateful to receive funding support from NHS charities to help us keep the running of the tea trucks. The funding from money donated by inspirational fundraisers, including the late Captain Tom Moore, helped pay for the supplies to keep the trucks on the road. As a gesture of our gratitude to Captain Tom and all who donated, we named one of our tea trucks Captain Tom, and we're even able to show the Royal Highness and the Duke and Duchess of Cambridge, NHS Charities Together patrons, this tea truck in action when they visited us at one of our ambulance stations. We are so incredibly grateful for the work of our wellbeing teams, our volunteers and all the organisations who have gone above and beyond to look after our people as we provide care for Londoners.
Thank you, Damien. And I can't impress upon everybody how much our staff really value the tea trucks. So it's something we want to keep going. Anthony's joined me because it's now time to take questions from the members of the public, or indeed our staff, which I may field out to some of my colleagues. Let us see how we go. Anthony.
Should we start with the first one, Heather, from Slido from Jay Smith. So Jay Smith says, you mentioned the cycle response unit has returned to service, but there was no mention of the motorcycle response unit. Is there any particular problem preventing the service from returning?
I think I need to get Daniel to field that one, please.
Do I come up?
You can come up. I'll let you come up. It's probably easier.
So in my first few days, I met both the riders, the paramedics from the motorcycle response unit and the bicycle response unit. I went out with the bikes in West End. It was amazing. I'm pleased to be able to say that the motorbikes are going to come back in a different form to how they have been in the past. So they're going to spend half their time in the control centre because they're very senior paramedics, working out which are the best cases for the motorbikes to be sent to, and then sometime on the road. And we're just doing all the redriving tests so they can get going very soon.
Thank you, Daniel.
Next question for the air ambulance colleagues. We have Cleo who's in the room, so she'll go round and take the questions with the film colleagues there. So next question, it's from Bob. Bob says, does the government fund the air ambulance? If not, why not?
Right. Jonathan.
Thank you very much for the question. It's a question that's asked of pretty much all the 21 air ambulances around the country. We are all we are all funded by the generosity of the people that we serve. I'm very proud to be so. If you look at the cost per intervention, it's an expensive service. As such, air ambulances in the UK have always been predominantly and proudly funded by the people that we serve, and there is no look for that to change. There are elements of government funding that come in. London Ambulance Service provide the paramedics, Barts Health provide the doctors, and we provide the logistics, the aircraft, the cars, and a lot that goes around that. And we're very comfortable with that as a position. It gives us a degree of freedom which allows us to continue to push on the innovation side, which is easier for us as an independent charity than it might have been if we were completely part of the machinery.
I think another question for you, so keep the microphone. It's Marty. Marty says, would the air ambulance and even LAS be open to corporate sponsors as a source of funding to supplement charitable and stretched government funding?
Oh, very much so. And we do enjoy the support of a number of London corporates already. So if there's any opportunity to expand that further, especially as we start looking towards 2025 with new aircraft, which are due at that time, any additional support would be gratefully received.
Thank you. Next question, Heather, is I think it's focusing on innovation again from Slido, from Joe. Joe says the partnership approach to stroke assessment via iPad was really innovative. How do you capture and encourage innovation from your frontline staff?
So I think that's really a question for our incoming chief exec. But what I would say, that's about listening to the staff. So as a chairman, I have a group of staff that meet me monthly virtually, and they tell me all sorts of things, which of course I feed back now to Daniel. And he joined us on the last one, and I meet the chairs of the subgroups, the LGBT, the women's group, etc. So there are many different ways to do that, but we need to do it more. Daniel, do you want to add to that? Because I know you're keen to have innovation.
So I think the only thing I would add is to say, so I've met hundreds of people who work in the London Ambulance Service who are brimming with great ideas about how we can improve our services. And we've now setting up lots and lots of ways to listen more and be able to do more. So I have a weekly blog that goes out, and one of the things I'm making sure we talk about in it is the things that we have heard and the things that we're now doing in response to listening. So there's a huge amount to do.
I mean, what I say to Joe, though, is clearly we can't take every innovation, so it might be that somebody's got a very good idea, but it might not be just for now, and we need to get better at explaining to people why their idea can't be one we could do at the moment, but might do later.
Thank you. Next question is looking at quality and patient care. So Alison says, demand has significantly increased with performance challenged at times. How will we continue to ensure quality patient care is central in everything we do?
I'll start and I'll hand over Daniel, see if you want to field to our clinicians. But I think one of the reasons we have a couple of non-exec doctors on the board in Professor Karen Brohy and Dr. Mark Spencer is to continuously challenge us, to remind us why we're there and to focus on clinical care. And I think over the last couple of years we've got better at making sure we do that. But it is a challenge. It's a good question, Alison. So, Daniel, do you want to hand to Fenella and John, or would you like to?
I'll just introduce them.
Yeah.
So Kadir has been our deputy chief exec and has done it brilliantly. In deciding who the next deputy chief exec should be, we decided as a board that we'd like to give that title jointly to our chief paramedic John and to Fenella, our chief medical officer, to demonstrate just how important we think the delivery of clinical care is to the ambulance service. So I think we should pass the baton on now to Fenella to talk about quality.
Yeah.
I shall pass it to you personally.
Thank you. So I think as we go forward into what we know is going to be quite a challenging winter, learning from every patient that we go to see, learning what we could do better for that patient and being able to take that back to make sure patients are looked after at the right time in the right place is what has to be at the centre of every interaction that we have, whether that's over the telephone or whether it's face-to-face. And our collaboration with the ICSs and with partners right across the NHS will enable us to do that better.
Thank you very much.
John, did you want to add to that, or you?
Next question is on staff development from Tim Gerhard. Tim says, how do you envisage enhancing the competencies and capabilities of your paramedics to enable them to deliver see and treat services, better see and treat services?
Very good question for John.
Thanks, Tim. So I think I alluded to earlier the career framework for paramedics that's been published nationally within London Ambulance Service. We're lucky because we already have the advanced paramedic programme that we saw on the videos earlier, and I outlined the pilots that we have within our primary care network. So the opportunities, I think, are around expanding those. For our paramedics who don't fall into that specialist or advanced category, it's going to be about how do we continue to improve their skills across the year. We have a skills refresher programme, and we're looking at how we refresh that at the time that's dedicated. We're currently sitting in one of our new education facilities. We have another one on the other side of London, and utilising them and our partnerships with higher education institutes to really focus on skills for paramedics over the coming years.
Thank you.
Thank you. Next question is from Sean. Considering clinical staff retention issues, has the organisation considered putting more funding towards developing other staff into clinical roles?
I think that's a good question, and I think the answer to that is yesterday. And we heard an example when we met a member of staff yesterday when Ruth May, the chief nurse from the department, from NHS England, came over, and we met an Australian paramedic who is a dual-trained paramedic and nurse. And that's something she was also going to take away, a 4-year programme, 3 years combined, and then 1 year you choose whether you're a paramedic or nurse. But John, do you want to come back on that?
I'll start and then go to Damien, I think, as our Director of People and Culture. So we are developing numerous career pathways. So for other healthcare professionals who want to transfer in, we have a master's programme that you can undertake in partnership with North West London University. If you want to join at the start of your career from somewhere completely different, you can join our apprenticeship programme at a variety of different levels to climb the career framework. So I want to take it to Damien.
Yeah. Thank you.
Thank you very much. We're also looking at different skill mixes, so I think recognition of introducing new clinicians into our pathways. So that work has just started and I expect to accelerate hopefully soon. I should plug, we've got 400 more staff in as we did a year ago, and I'll probably take this opportunity to look at NHS jobs if you are interested to find our roles in London Ambulance Service, which is a great organisation, obviously.
Leave the mic with Damien. I think the next question is coming to him, but it's obviously up to the chair to decide. Ro Connor on YouTube says, hi, I want to be a paramedic.
Wow. So there we go, Damien.
NHS jobs and any problems, please contact me directly, Damien McGuinness, and you'll find me on the website. But we've got lots of pathways and introduction into the organisation, so I'm sure we'll find a way in.
So I just want to share that I took a 12-year-old to London Air Ambulance at Fenella, and I facilitated that a finance director in another part of the NHS has 12-year-old twins. One wants to be a paramedic. And as part of that programme, you were able to facilitate a visit. She thought it was awesome, best thing ever. So there's our youngest recruit, and we need to get better at getting people at school age to think that's what they want to do.
Thank you very much, Heather. I think the next question is coming my way, but you'll decide, I'm sure. Joe wants to know how we can work out via the people watching on YouTube how many are staff and how many are general public.
Anthony, would you like to answer that question?
Yes, so we can't tell everyone because obviously people watching on YouTube can just join, so you don't have to register. But we did ask people to register so we can then tell who is a staff member and who's not. So we'll have those figures afterwards. Joe, if you're very interested, I'll be more than happy to share them with you. No further questions, but a few comments, Heather, if I can read them. So from Facebook, Sean Summerfield said, good evening to everyone at London Ambulance Service. I hope you're well. Thank you to all and have a good and peaceful evening. Everyone stay well and safe. And Woolboy on YouTube said, I love the ambulance service. Stay safe, everyone. And then last and not least, Dr. Helene Brown, Medical Director, System Improvement and Professional Standards for NHS England, London region, said, I greatly appreciate working with LAS. In a time of great need, our LAS colleagues are continuously striving to improve the care provided for patients. The clinical leadership offered by LAS does not only reach LAS staff, but also contributes significantly to system leadership across the whole region.
Thank you very much. So, we are nearly at the end, but what we like to do at our AGM is to recognise a member of staff or volunteer for exemplary service. So I'll ask Daniel to join me first, please. So this year, we'd like to recognise one individual for outstanding service, John Boyram, who thinks he's here representing NETS, but he's not. So let me tell you about John. He's worked for the LAS for 50 years. He joined in 1971, originally as an emergency medical technician, before shortly moving to join our control room, and is now non-emergency operations manager. Hearing from John's team and managers, his passion for the well-being of his patients and the staff within the service is second to none. He has served many local hospitals and communities and has paid home visits to patients and make sure they were thoroughly looked after by the service. He's been recognised by colleagues for his dedication to go above and beyond for his team, being there for colleagues day and night over 50. Over 50 years. And before I ask you to come up and get your certificate, there's another surprise. So would your family members like to join us? So, John, would you like to come up, please?
Awesome. Brilliant.
Very proud family, I think. Very, very proud. We're all very proud.
I'm the one who should be crying. Well, certainly a surprise because I thought I was coming here to present NETS, as our chair lady said. I was asked once, many times I've been asked, why have you lasted so long? And I said, well, it's a job that from the day I joined the service, bearing in mind I'd applied for the Air Force and I was ready, packed on my way to RAF Manston in Kent, and I suddenly realised I'm going to miss my mum. So I decided, no, I'm going to join the ambulance service because I want to look after people of London. Now I'm getting a bit emotional. And it's been a long journey. I've seen many changes throughout the service, but every single moment of my career I've enjoyed, and I still enjoy now at the tender age of 30. And again, I've been blessed by having quite a few supportive mentors over the years who, sadly, perhaps many of them not with us anymore. And I've had some good staffs that I've supported and I've managed, and they've actually moved on to become managers and officers in their own right. And I continue to support my staff, which I think is important, and I will continue to do so and provide as much care to my patients as well as the service. Thank you. Of my family, of course. We met in a control room in 1980. Let's say we met 41 years ago in the old CAC, or Redbridge it was known at the time. And I'm very grateful for them. They've been very supportive over the years, and my grandchildren as well. And I'm sure they've been looked after, and I'm sure that you've taken care of making sure that they're looked after at the moment. That's good. Thank you very much.
Well, you don't have to go. You could just stay. We're just finishing. So it is so emotional. 50 years is just awesome. Thank you. So final comments from the meeting. I hope that we've evidenced tonight that not only do we meet our statutory duties, we do our best to do all of that, but to provide care to patients in a way that continuously improves, whether it's working with air ambulance, other hospital trusts, mental health, And we've got end-of-life care nurses, mental health nurses, maternity nurses, all of whom have won awards this year. It is a big change for us, seeing paramedics develop, but teams working together across the capital in extraordinarily difficult circumstances. So I'd like to thank everybody for attending tonight and everything that you all do, and have a good evening. Thank you.